Hello, I'm Dr. Rosie, and I'm here to talk to you today about the importance of informed consent when it comes to birth. Now, the decisions and conversations and interpersonal interactions that surround birth are so incredibly important. And along with what happens kind of physically and medically and how your birth unfolds, it's these interactions and the way that we are talked to and involved in decisions about our birth that can make a massive difference and really shape, I think, our experience of giving birth. So when these conversations and decisions go well, one of the things that I have noticed is that it's often because there is a genuine shared foundation of understanding your right to informed consent. And this understanding kind of sits between you and your caregiver, and it acts as the foundation for all of the other conversations that you might have during your pregnancy as they support you through all of those kind of checks and scans and appointments, all the decision points that happen in kind of late pregnancy and into the birth. So when we're talking about informed consent, right, what am I actually talking about here? Well, informed consent basically means your right to make your own decisions about what happens to your body and your baby during your birth experience and your pregnancy. So, it's really that you have the right to choose and make your own decisions about medical treatments that happen to you, and nothing happens without your explicit agreement. Now, unfortunately, many families do not experience these kinds of conversations in maternity care. And I hear it all the time in the language that people use when they talk about their birth experience. So this is not necessarily, when people come to me to talk about birth trauma, which is obviously one of my main roles as a perinatal psychologist, is to see people who have experienced traumatic births. But I'm talking about the way people talk about birth at mother's group, the way my friends have talked about it, the way people talk about it with their friends. And it's phrases like, I wasn't allowed to use the birthing pool, or they said I had to be induced, or they decided that I needed a C-section. Have you noticed this? It's often such a natural way of talking about birth. It's become so normal, I think, that we often don't register when we hear people talking about birth decisions in this way. But we should. Because I think the reason this seems normal is because it's often exactly how these conversations and decisions do play out in maternity care. Especially when it's our first time going through pregnancy and birth, we're told to attend the various appointments and have certain measurements and have certain tests and scans, and when we have to show up and at what point and what for. And we don't know that system at all. We actually go into that system needing and expecting to be told what to do. And because we don't know how any of it works, and they do, that's an inevitable power differential between us and care providers right from the start. So I think what happens is we tend to do as we're told, right? When I went into labour with my first baby, I think it was bang on 36 weeks just, I was admitted to the hospital maternity ward instead of the birth centre that I had hoped to birth in. And I didn't know at that point that I could choose not to have the continuous monitoring or the vaginal checks. And looking back, I may well have consented to them anyway, right? Like I did want to know what was happening for my baby and whether my labour was progressing. But perhaps I may not have done had I been talked through some of the risks and the benefits of that monitoring and that checking. Perhaps I may not have done had anybody mentioned an alternative ways of seeing how far along labour was progressing or how my baby was doing. Or had I even known that these were things that I could choose or potentially decline, right? And so many of the mums that I see who do come in and see me to talk about their birth experience describe a sense that in one way or another, their birth slid out of their control. And sometimes this is purely because a medical complication unfolded that required urgent intervention, right? But often this is also how it feels when things start to happen to our bodies and our births without our explicit, informed consent. So experiences of coercion and a real lack of informed consent was a major factor that was identified in the recent report from the New South Wales Select Committee on Birth Trauma. And the report explained that healthcare providers can sometimes be operating under the assumption that they don't need to obtain your informed consent for routine procedures, which means that women often don't feel like they have the right to decline them or refuse them. And hospital guidelines, policies, and protocols are often written in such a way that means that these kind of routine interventions and procedures are presented as mandatory, like they're presented as something you actually do have to do. And this means that families are actually often coerced into following the policy instead of being given the right to choose. Now, whenever a woman isn't given much of a choice or is not properly informed about the interventions that she ends up experiencing, it naturally has a big impact on the way that she feels during the birth and afterwards as well. Because any experience of being coerced into an intervention, being threatened or dehumanized, those are the elements that are often described as the most distressing elements of a difficult birth. And in fact, studies have shown that it is those interpersonal interactions that can be the highest predictor, the strongest predictor of PTSD symptoms after the birth, even having a greater impact than the level of emergency intervention required. So this is telling us something very important about the way decisions are made, really shaping our experience of birth and how that ends up being experienced by us as the women in the center of everything and taken forward with us afterwards as well. Now, the flip side of this, if we turn it on its head, it means that respectful, supportive maternity care can actually make a hugely positive difference to your birth experience. When complications do occur in birth, or there are these complicated decision points that arise, clear communication about what's happening, first of all, can provide a bit of a sense of calm in the storm. If someone is telling you, this is what's happening, this is what we think is happening, this is why, this is what I think we're going to do, that can make a big difference to how safe and contained the whole situation feels. And if your care providers can just calmly explain to you what is being recommended and why, and help you to understand the risks, the benefits, the alternatives, and actually sort of support you to make what might be a really difficult decision, it can give you a greater sense of clarity around that decision and control and actually a sense of safety, even if birth takes a really challenging turn. So I think it's really important to know that it is these respectful conversations that are important and provide you with a sense of autonomy in birth, and that these are absolutely possible, right? There are providers out there who will work with you to ensure that you are given all of the information and will support you to choose what is right for you. And I've experienced this personally too, with a midwife who was more than comfortable with my right to choose. And because that was how she was comfortable setting the relationship up from the start, it was never kind of anything that had to be fought for or contended between us. She handed guidelines to me and evidence to me so that I could make the decisions about my body, my birth, my baby. And actually, I didn't end up being able to give birth with her. And I ended up having to have a ambulance transfer to a different hospital. But I think that when that happened, one of the things that helped me to hold on to a sense of being in control, some sense of being in control during that, was that I was very comfortable by then making decisions about what I was and wasn't willing to consent to, asking for the information. And even in a really quite extreme situation, I felt more than comfortable to do that. So if you are watching this as a parent who is wanting to reduce your own risk of a traumatic birth, I want you first and foremost to go into your birth knowing that this actually is what you are entitled to in maternity care. Informed consent is your right. And simply knowing that you have the right to informed consent can shift how you respond in situations where hospital policy or other people seem to be dictating your birth decisions. You can ask for more information about the risks and the benefits. You can ask to be talked through the alternatives so you can choose which one is right for you. You can find out if the steps being recommended to you are being based on hospital policies or concerns about your specific pregnancy and your baby right now. And perhaps most importantly, going into birth with a strong understanding and a strong sense of your rights can really help you reclaim that feeling of agency and that sense of control, which are incredibly important factors in having a positive overall birth experience. So if you have experienced a distressing or traumatic experience in the past connected to a previous birth, and that's a lot of the mums that I work with are coming to see me because they have had a previous birth experience that did not go to plan, that really included some experiences that were quite distressing, quite out of control, and left them feeling quite traumatized. And people come to see me because we do a lot of work on how to prepare for a much better birth experience next time. If you are in that position, I have created a little fact sheet for you, which you can download on informed consent. And this is guidance for those who are preparing to birth again after birth trauma. This is just information that I want you to have to hand as you go into your maternity appointments. And I really hope it helps you prepare for a much better birth experience next time.